Red alert. 13 signs of skin cancer. Your body is trying to show. Have you ever wondered if that little spot on your skin could be something more serious? Is your body trying to warn you of a silent danger that grows day by day? What if the signs are right in front of your eyes, but you just don't know how to recognize them? Skin cancer is one of the most common types of cancer in the world, affecting millions of people annually. The scariest thing is that many times, its first signs are subtle and easily confused with harmless problems. Every minute without diagnosis allows malignant cells to multiply silently under your skin. Did you know that just 5 severe sunburns in your youth can double your chances of developing this type of cancer? Early detection can literally make the difference between life and death. The signs we are going to reveal today are often ignored or minimized by people who later discover that they are in advanced stages of the disease. Knowing these 13 silent symptoms may be the most valuable knowledge you will acquire today. Let's get started. The silent alarm, stains that refuse to disappear. The first signal your body may be sending is a spot that just won't heal. Usually, small wounds on the skin tend to heal completely within a few weeks. When an injury remains for more than a month without healing, it may indicate something more serious. These spots can appear as reddish, pinkish areas, or even as small wounds. Many people mistake these lesions for persistent pimples or simple skin irritations. The crucial difference is in the duration. While common skin problems tend to improve over time, cancerous lesions remain or worsen. You may notice that the area occasionally bleeds for no apparent reason, especially after showering or when drying your face. An injury that bleeds, itches, or hurts without having suffered trauma should ignite an immediate alert in your mind. This persistence is one of the body's mechanisms trying to draw your attention to something that is not working properly. In many documented cases, patients have reported ignoring these spots for months or even years, mistaking them for eczema or dermatitis. Basal cell carcinoma, the most common type of skin cancer, often manifests in this discreet way. Look at your skin now. Are there any blemishes that have been present longer than they should? Time can be your ally or your enemy when it comes to skin cancer. What if that little wound you've ignored for months is silently spreading under your skin? Dangerous metamorphosis. When common moles turn into threats. Observing changes in pre-existing moles may be the secret to detecting melanoma, the most aggressive type of skin cancer. Your body is constantly renewing itself, but normal moles usually maintain their appearance over time. When a mole begins to change size, color, or shape, your body is signaling that something abnormal is happening. The ABCDE rule is a valuable tool that dermatologists use to identify suspicious moles. A stands for asymmetry. Cancerous moles are often irregularly shaped, unlike benign ones that are symmetrical. B stands for edges. Irregular, jagged, or ill-defined borders can indicate malignancy. C stands for color. Color variations within the same mole are an important warning sign. D stands for diameter. Lesions larger than 6 millimeters, about the size of a pencil eraser, deserve attention. And it stands for evolution. Any change in size, shape, color, or associated symptoms should be investigated. A mole that begins to show different shades of brown, black, red, or even blue may be revealing a malignant transformation. Many people are born with dozens of moles and rarely notice subtle changes that occur over the years. Photographing your moles periodically can help monitor changes that would be difficult to notice with only occasional observations. Melanoma is especially insidious because it can develop from moles you've had since childhood. When was the last time you really examined your moles carefully? What is your skin trying to tell you at this moment? The deadly disguise, pearlescent lesions that deceive the eyes. One of the most misleading signs of skin cancer is lesions that look pearly or translucent. These small bumps may appear harmless and are often mistaken for benign cysts. They appear as bumps on the skin with a color reminiscent of a pearl or a small transparent globule. Unlike common pimples or cysts, these lesions rarely go away on their own. Basal cell carcinoma often manifests in this way, growing slowly in sun-exposed areas. These lesions may have small blood vessels visible on the surface, giving a slightly pink appearance. To the touch, they are usually firm and painless. which contributes to them being ignored for long periods. The pearly and seemingly healthy appearance of these lesions is precisely what makes them so dangerous. They don't look threatening. Studies show that lesions of this type are often overlooked because they don't fit the mental image we have of something cancerous. Many patients report noticing these bumps for years before seeking medical evaluation. A trained dermatologist can identify these lesions quickly, while laypeople often mistake them for benign birthmarks. The face, ears, neck, and scalp are common sites for the appearance of these pearly lesions. Have you noticed any new elevations in the skin that appeared translucent or shiny under certain lighting? Could what seems to be just a harmless mark be hiding something more serious? The desperate message: when your skin begs for attention. Persistent itching in a specific area of the skin can be more than just a passing nuisance. Your nervous and immune system may be trying to alert you to abnormal cellular changes through this sensation. Skin cancer-related itching is usually concentrated in a specific area and does not respond to conventional treatments for dry skin. Unlike allergies or eczema, this itching tends to be persistent and can gradually worsen over time. Often, people treat these symptoms with moisturizers or corticosteroid creams without realizing the underlying cause. An area that constantly itches, even without significant visible changes, deserves medical attention. Unexplained and localized itching may be the first noticeable symptom long before any visual signs appear. Scientific studies have identified connections between chronic skin inflammation, persistent itching, and the development of certain types of skin cancer. In some cases, patients report feeling a strange sensation in an injury years before the formal diagnosis. Your body has sophisticated mechanisms for detecting abnormal cells, and itching may be a neurological response to these changes. It's easy to dismiss this symptom as trivial in our busy lives, but it can be a cry for help from your body. Do you have any area of skin that itches persistently for no apparent cause? What if that itch you've been ignoring is actually your body's desperate plea for medical attention? The mask of disease: rough areas that hide something worse. Rough or scaly patches on the skin, known medically as actinic keratoses, can be precursors to skin cancer. These lesions usually appear in areas frequently exposed to the sun, such as the face, ears, lips, and backs of the hands. To the touch, they look like small areas of dry skin, sometimes with a texture similar to fine sandpaper. The coloration can range from light red to brown, or even skin color, making them difficult to identify visually. Many people confuse these lesions with simple skin dryness and try to treat them repeatedly with moisturizers. The distinguishing feature is that unlike normal dry skin, these areas persist even with adequate hydration. These small, rough spots are often called precancerous lesions because they can develop into carcinomas if left untreated. Studies show that people with a history of intense sun exposure are more likely to develop these lesions. Dermatologists consider the presence of multiple actinic keratoses to be a strong indicator of increased risk for skin cancer. These lesions can appear and disappear spontaneously, leading many people to mistakenly believe that they do not pose a danger. The rough texture is a result of the abnormal proliferation of cells in the outer layer of the skin due to damage caused by ultraviolet radiation. Have you ever noticed persistently rough areas on your face or other sun-exposed parts? What could happen if that dry skin on your face is actually the first stage of a malignant transformation? Subtle alteration, fatal consequence, changes in texture that no one notices. In addition to roughness, other subtle changes in skin texture can signal the development of cancer. Areas that become inexplicably firmer, depressed, or elevated deserve special attention. A change in the way the skin moves or folds in a certain region may indicate abnormal cell growth. You may notice that a small area of skin appears tighter or less flexible than the surrounding tissue. These changes occur because cancer cells often affect the structure of collagen and elastin in the skin. In some cases, the affected area may appear slightly sunken, like a small scar with no apparent cause. Cancer cells often alter the normal architecture of the skin long before they produce obvious, visible signs. Health professionals are trained to detect these subtleties through touch, what they call tactile diagnosis. Patients often report noticing something different about an area of skin long before any visual diagnosis. The importance of these texture changes is greater in areas that are not usually examined, such as the back or scalp. Changes in skin texture can be more easily noticed during the application of moisturizers or sunscreens. Have you ever felt any area of your skin that looks different to the touch, even without significant visible changes? Is there a place on your body where the skin doesn't move or feel as it should? Danger borders, jagged edges that herald trouble. The edges of a skin lesion can reveal important information about its nature. Benign lesions usually have regular, clearly defined, and uniform borders. In contrast, cancerous lesions often have irregular, ill-defined, or notched borders. This irregularity occurs because cancer cells grow at different rates, creating an uneven pattern of expansion. Looking at the edges of any blemishes or lesions is a crucial part of skin self-examination. Doctors use dermatoscopes, which are special magnifying glasses, to examine the edges of suspicious lesions in detail. The jagged borders are like chaotic borders, where healthy and cancerous cells are in constant battle. The presence of jagged borders on a lesion significantly increases the likelihood of malignancy. Scientific studies confirm that the irregularity of the edges is one of the most reliable indicators in the detection of melanoma. In early lesions, this characteristic may be subtle and requires close observation or magnification to be perceived. Photographing suspicious lesions and comparing their edges over time can help identify worrisome changes. Have you ever carefully examined the edges of the spots or moles on your body? What are the borders of your skin lesions trying to tell you about what's going on below the surface? Secret skin code, color changes that reveal the enemy within. Subtle changes in skin color can be important signs of early-stage cancerous processes. A mole or spot that gradually changes tone, becoming darker or lighter, deserves attention. Lesions that present multiple colors simultaneously, shades of brown, black, red, blue, or white, are particularly suspicious. Melanoma, specifically, is known to exhibit this variety of colors in a single lesion. Areas that lose pigmentation, creating lighter spots within dark lesions, can also indicate malignant transformation. The presence of bluish or grayish coloration in part of a lesion is considered a significant warning sign. The color variation in a single lesion can be compared to a map that reveals different levels of cell invasion and metabolic changes. Dermatologists are trained to recognize specific patterns of color distribution that suggest malignancy. Changes in skin color can happen gradually, so it's important to document and monitor injuries over time. The appearance of reddish or pinkish tones in previously normal areas may indicate increased vascularization associated with cancer. Early diagnosis based on color changes can mean the difference between a simple treatment and a more complex one. When was the last time you noticed changes in the color of your moles or blemishes? What messages could your cells be sending through these subtle color changes? False scars, the perfect disguise of skin cancer. One of the most misleading disguises of skin cancer is lesions that resemble small scars. These marks may appear without any history of injury or trauma to the affected area. They usually have a flat or slightly sunken appearance, with a whitish or slightly pink color. Squamous cell carcinoma, especially in the early stages, can manifest with this harmless appearance. Many people ignore these injuries precisely because they appear to be unimportant old scars. The crucial difference is that, unlike true scars, these lesions can change subtly over time. These false scars are often the perfect disguise for cancer cells, as they rarely arouse concern. Studies show that patients often report having always had these marks, even when they are relatively recent. Memory can deceive us when it comes to small changes in the skin that appear gradually. Dermatologists recommend investigating any scar-like marks that appear with no apparent cause. Sun-exposed areas, such as the face and neck, are common sites for these deceptive lesions to appear. Do you have any marks on your skin that look like a scar, but you don't remember hurting yourself in that spot? What if what appears to be just a harmless mark is actually an important warning sign? Silent signs, flat spots that hide a deadly secret. Flat reddish or brown spots can be silent indicators of specific types of skin cancer. These lesions usually do not cause any discomfort and are easily confused with freckles or benign sunspots. Squamous cell carcinoma in situ, also known as Bowen's disease, often presents in this way. These spots have well-defined edges and scaly surface that can go unnoticed to the casual touch. Unlike normal freckles, these lesions tend to persist year-round without lightening during the winter months. They usually grow slowly but steadily, gradually increasing in size as the months go by. These seemingly harmless spots can hide cancer cells that have not yet invaded deeper layers of the skin. Because they are flat and painless, these lesions rarely attract attention, allowing the cancer to develop silently. Studies show that early diagnosis of these flat spots results in cure rates close to 100%. People with a history of chronic sun exposure are at higher risk of developing this type of cancerous lesion. Areas rarely protected with sunscreen, such as the back of the hands or ears, are frequent places for these spots. Have you ever noticed reddish or brown spots that have appeared recently and don't go away? Are your freckles really just freckles, or could they be something more serious? Blood as a warning, your skin's last cry for help. Spontaneous bleeding in skin lesions is one of the most alarming signs and should never be ignored. Unlike common injuries, cancerous lesions can bleed without significant trauma, or even without any trauma at all. This bleeding is usually light, intermittent, and stops on its own, leading many people to downplay its importance. It can occur during everyday activities such as washing your face, drying off after showering, or while sleeping. Spots that repeat this bleeding pattern, even if separated by weeks or months, deserve immediate evaluation. Bleeding happens because skin tumors often develop fragile and abnormal blood vessels. When an injury bleeds for no apparent reason, it's as if your body is sending a literal red signal that something is very wrong. Studies show that spontaneous bleeding is associated with more advanced stages of skin cancer. Patients often report ignoring this symptom because they consider it related to dry or sensitive skin. Bleeding is particularly significant when it occurs in lesions that also have other suspicious signs. The discovery of blood on the pillowcase or on clothes without apparent cause should always raise suspicion. Have you ever noticed unexplained bleeding in any spot or lesion on your skin? How much longer would you wait before seeking medical help if you discovered blood from a seemingly harmless injury? When the sun becomes the enemy, the hypersensitivity that no one should ignore. A sudden increase in sun sensitivity in specific areas of the skin can indicate precancerous cellular changes. This hypersensitivity manifests itself as redness, burning, or intense discomfort after minimal sun exposure. Unlike normal sunburn, this sensitivity tends to be concentrated in specific areas of the skin. Precancerous lesions such as actinic keratoses often present this symptom as the first noticeable sign. People who were already used to a certain level of sun exposure can suddenly develop this abnormal sensitivity. The reaction occurs because damaged cells respond in an exaggerated way to ultraviolet radiation. This selective hypersensitivity is like a biological alarm warning that a certain area of the skin has lost its normal protective mechanisms. Dermatologists consider changes in the way the skin reacts to the sun as an important signal for investigation. Research indicates that hypersensitive areas often reveal cellular changes when examined under a microscope. This symptom is particularly relevant in people who work outdoors or who play sports exposed to the sun. Hypersensitivity can precede the appearance of visible signs of skin cancer by months or even years. Have you noticed any changes in the way your skin reacts to the sun in specific areas? What could it mean if an area of your skin started to protest against the sun when there was never a problem before? Fatal imbalance, the asymmetry that can save your life, if caught in time. Asymmetry is one of the most reliable indicators for distinguishing benign from malignant lesions. While normal moles tend to be regular and symmetrical in shape, cancerous lesions often have irregular shapes. If you draw an imaginary line dividing a lesion in half, the two halves should be similar in benign lesions. Melanoma, in particular, is known for its asymmetrical growth and irregular shape. This asymmetry results from the uncontrolled growth of different populations of cancer cells within the same lesion. Looking at the shape of your moles and spots can be the first step in identifying potential problems. The asymmetry in skin lesions is like a cancer fingerprint, a chaotic pattern that reveals the disordered nature of the disease. Dermatologists use asymmetry as the first criterion in the ABCDE rule for evaluating suspicious lesions. Photographing your moles and analyzing their shape periodically can help detect subtle changes in symmetry over time. Studies show that highly asymmetric lesions are significantly more likely to be malignant. Even experienced practitioners use digital devices to accurately measure the symmetry of dubious lesions. Have you ever examined your moles looking for signs of asymmetry or irregular shape? What if the difference between health and disease is hidden in the irregular shape of a mole that you have never looked at closely? Your power to turn knowledge into protection. We have reached the end of this journey of discovery about the silent signs of skin cancer. The knowledge you've acquired today is literally a life-saving tool, yours and the lives of people you love. Remember that these symptoms rarely appear altogether and are often so subtle that they go unnoticed. The key to effective protection lies in regular vigilance and knowledge of your own body. Take a few minutes each month to examine your skin, looking for any of the signs we've discussed. Use mirrors to check hard-to-see areas, such as your back, or ask someone you trust for help. Photograph suspicious lesions and compare them over time to identify subtle changes. Early diagnosis transforms skin cancer from a potentially life-threatening condition into a highly treatable condition. Never hesitate to see a dermatologist if you notice any of the warning signs we've discussed. Protect yourself daily with sunscreen, appropriate clothing, and avoiding sun exposure at peak times. Share this knowledge with friends and family. Education is our most powerful weapon against this disease. Remember that you are the best advocate for your own health and the most qualified to notice subtle changes in your body. Your skin tells a story. Learn to listen to their messages and respond to their warning signs. Life is too precious to be compromised by a disease that, when detected early, has high cure rates.